Thank you so much today for joining us for Fact versus Fiction, Planning versus Coronavirus in Your Workplace. COVID-19 is a virus that has hit the world very, very hard, and we want to see what kind of strategies, resources, tools that we can share with you today, and how you can continue given this long road that we have ahead of us. This is Nora O'Brien. I'm the CEO of Connect Consulting Services. We are really appreciative you're able to join us, and let's get started. If you haven't been, or if you're not that familiar with GoToWebinar, you actually have a place that you can actually ask questions. So we will be monitoring those questions throughout the presentation today. If you please don't wait, we're going to leave questions to the end, and also questions, but also comments. If you want to put those in those question log, we will be able to get to them by the end of the presentation. But we won't be stopping in the meantime. But if you have questions as we're speaking, that's a good place to go and just leave that question in. So this is our agenda for today. We're going to talk about the pandemic planning phases. You feel that just to have an understanding that there is actually some phases to this process. We're going to talk about facts and fiction and what's known to date, and we know that that information is changing all the time. But what we know to date, how it impacts you, how it impacts your workplace, and some questions and comments, and we have some offers and also some resources available. Okay, here are trainers for today. I'm Nora in the center, Nora O'Brien. I'm the master's degree in public affairs with disaster and emergency management concentration. I'm a certified emergency manager. I'm also the past chair for the IAEM Healthcare Caucus, which certifies me as a certified emergency manager. I'm a FEMA instructor, and also I led the H1N1 pandemic response for the California Primary Care Association and for our clients 2009-2010. So I'm going to talk about some lessons learned that I have that might lend itself, that might be helpful for you as you're trying to plan through COVID-19 response. On my left of this photo, we have Karen Garrison, our Director of Aging Services. You'll hear from her in a few. She has background in community-based organizations, disabled adults, senior centers, case management programs, assisted living, with the focus on Alzheimer's care. On my right, I have Lori Benblatt, Global Health and Disaster Emergency Readiness Specialist. She's our planning specialist. She's also a disaster behavioral health specialist, and has worked not throughout just the U.S., but also across the world, Zimbabwe, South Africa, Haiti, and Brazil. Did also a lot of Hurricane Maria response, etc. So we have years of experience with global point but also emergency management, business continuity. So we're here to share with you some of our thoughts and hopefully point you in some resources that will support your process as we try to navigate COVID-19 moving forward. This is I want to give you a little tip about emergency management. So a lot of us are very geeky. I'm going to give you the lowdown. This is something that we say all the time for those of you that are not emergency managers and you're just trying to manage this incident. So our motto is Semper Gumby, always be flexible, because you never quite know what you're going to be dealing with, whether it's a hurricane, a flood, fire, and now we're dealing with COVID-19. Semper Gumby actually might be your friend. So maybe that's going to be helpful to you. Maybe it's a little silly thing, but the point is in a disaster, you never quite know what's going to be coming your way. So being flexible and being a problem solver moving forward will be helpful as you manage this incident. The other thing we wanted to kind of give you some framework for understanding how to manage a crisis. So for those of you that are out there today that are already that have been in the military, you've seen this before, the OODA loop, which is observe, orient, decide, and act. And why it's a loop is that it's a process for you, because when you're in the process for on the OODA loop, The issue is that when something happens, you want to observe what's going on and figure it out. Then you want to orient where that information that you're dealing with moves forward. And you orient to figure out what does that mean for me. So observe the situation that's going on, what that means for me is orient. Decide what decisions you need to make in order to address whatever that situation would be. And then you take an action and go, okay, I'm going to do these things. And why it's referred to as a loop is that this is a very helpful process in managing crisis, because when new information becomes available, this whole process will repeat itself. It might be 10 minutes later, you might make a decision and you're happy with that decision. It's going to be a good decision based on the information that you know at the time, but you might need to make a decision that's exact opposite of one you just made 10 minutes ago. That's okay. But understanding that managing a crisis and that OODA loop process might be helpful for you as you're figuring out, what are we going to do? How is it going to impact me? What decisions do we need to make, and what actions we need to take? So just want to give you a kind of a framework of understanding how to manage crisis. The other thing we wanted to share with you is these pandemic phases that are from the World Health Organization. At the top there is the hot link to this graphic, and a lot of them far more information than we can share just in this one graphic, but I wanted to bring to your attention. So we've seen with COVID-19, we did a webinar a couple of months ago, and we had 5,000 cases in China in January 29th. So we're now today over 205,000. So obviously 200,000 more in just a short amount of time, 6 to 7 weeks. So obviously we're at the point, we're not in the 1 to 3, we're moving into the widespread human transmission infection process, the phase 5 and 6. So we're definitely in phase 4, sustained human transmission. We had months and we continue to see rate cases happening. And why this is important for you to see what these phases are is that this particular, this pandemic phase, we might be in this holding pattern of widespread human-to-human transmission infection. It might be months, and it might be up to until we have a vaccine. It might be a year from now. So it's important to know that what to do and the decisions that you make. Again, going back to the OODA loop discussion, is that the decisions you make now might be very different a month from now, 6 months from now, a year from now, but understanding that there are some phases to it. Oftentimes too, what happens is when there's a big spike, here the widespread human transmission, and then people started going back to their daily lives, and then you might have another peak. And so all of the social distancing that governments around the world, not just in the US, and we're based in California, so we're obviously very focused on what's happening in California, but you might have another spike of this of the virus outbreak if people kind of go back to their lives. So we're going to talk a lot about today about social distancing and how it might impact your business, but also yourself. And then you get back to the post-pandemic. So this whole phase this time might be a year, might be a year and a half. We don't know what that means. So moving on to the next slide here. Okay, I want to share with you a little bit from the lessons learned from 2009 to 2010, the H1N1 pandemic. It was an influenza pandemic. Today we're dealing with a coronavirus, which is a little bit different. But some of the lessons learned. So I was at the California Primary Care Association representing the nonprofit community health centers in California, over 1,000 plus at that time. And so I was 7 years prior to the H1N1 pandemic in 2009. I was doing pandemic planning with hospitals, Department of Public Health, hospitals, other primary care, with skilled nursing facilities, and kind of figuring out how we're going to manage and coordinate that medical response to a pandemic, and what the modeling looked like, and how many what the illness rate looked and the death rate looked like, and that sort of thing, and what kind of the logistics around dealing with that. So that was up to 2009. So then the actual pandemic hit in April of 2009. And what we ended up seeing was supply chains of personal protection equipment. Again, we're seeing that again, the masks, et cetera, were globally impacted because everyone thought they all just needed a mask. And we're in that same situation today. But that supply chain, what happens is it breaks. And when those supply chains break, specifically to personal protection equipment, it means there may not be enough for healthcare workers to be protected. And you really want, as much as you want to have that mask and you think that that's what you need, the issue is that there's not enough masks. It means there's not enough for those healthcare workers who might save your life. So just want you to think about that. The other thing that we saw during the H1N1 pandemic is we had very unclear guidance on healthcare worker protective measures. So for example, the CDC said one thing around gloves, gowns, masks, etc. Department of Public Health in California said eye protection as well. And then some local county public health had another set of recommendations. And so it was just very, it was a little confusing for healthcare workers because we were representing healthcare workers at the time about what they really needed to do to protect themselves. The other thing that was really crucial, and at the top there, the photo on the right, this is a drive-by clinic. Pointed dispensing for the, or pod planning, you might be hearing this if you contact your local public health. Pod planning was crucial to vaccine distribution because you wanted to have a plan of how you're gonna, you don't just go, vaccines available today and have everyone show up and rush your facility, rush your organization. So pod planning with your local health department was really crucial to getting the vaccine where that was needed. Social distancing in 2009 to 2010 was encouraged, but it wasn't required. We still had the X Games. We still had, people still went around their, went on their daily lives. People, we had the Olympics in 2010. So those kinds of things happened. But it was, because the virality, it was not nearly as viral, it was more mild, but it was still a pandemic because it was widespread human transmission. Most people were treated in a primary care setting and not in hospitals. So that's very different than what we're dealing with today, where you see a lot more hospitalization. So it was treated in a primary care setting because it was more milder symptoms. And so so that was just kind of a little bit different from what happened, what we're looking like today. The other thing that happened in 2009, the vaccine only took 6 months to make and distribute. We got very lucky that we got a vaccine so quickly. I mean, many of you have watched the news, obsessively about a vaccine may not be available for a year to a year and a half, even though the vaccine clinical trials are starting, it's not going to happen overnight. We, in 2009, actually got vaccine within 6 months. So we may not be so lucky, and maybe it wasn't as a virulent strain. The other thing is that on a planning side, we referred to, many of us in emergency management referred to H1N1 as the plandemic because the virus was mild. It still allowed you to test your plans, but it wasn't, and it was widespread, so it impacted everybody, but it wasn't as viral, which means that you didn't have, allows you to still test your plans and make sure that you're ready for the big one, so to speak, and where we're at right now, referring to COVID-19. But those are some of the lessons learned that we had, and hopefully some of those might be helpful for you as you're figuring out what that arc of response and recover will be, and because it also went into well into 2010. So April of 2009, it was announced by WHO declared pandemic, and it wasn't essentially declared over until well into 2010. So, okay, here we go. Couple of things about COVID-19. None of these things are very, we're all obsessive in watching the news. We get that. I certainly love, the opportunity like Texas, this came from city of Round Rock, Texas. I love this. Wash your hands like you just got done slicing jalapenos and a batch of nachos. You need to take your contacts out. I love that. I mean, what this shows is This is really important, and we want to just wash our hands, but the point is, not saying that we necessarily have a ton of humor in it, but it just, those kinds of light moments really do kind of help in this kind of situation. The other thing that we're dealing with, wash your hands, cover your cough, don't, keep your distance, stay home, and get help. Call your provider when you think you might be experiencing symptoms. These are, we're very familiar with what these look like, but it's just nice to have these kinds of information because moving into the future, we're going to continue to see the outbreak of the event. So I want to talk a little bit about impacts to date. More than 205,000 cases, more than 8,200 deaths worldwide. This hot link right here is the Johns Hopkins interactive map. You may or may not want to look at that map on a regular basis because it is, it is broken down by, by country and by within the country, state, and et cetera. How many cases, how many people have recovered, et cetera. But that might be useful for you in your planning. Extreme social distancing, shelter-in-place orders and directives are going around across the globe. Obviously, most recently in the U.S., California has 7 various cities impacting 6.5 million people were impacted. We're going to continue to see most of those things into the future. The United States, a presidential declaration happened last year. Boy, it feels like last year, forgive me, just last week. And what that means is that they can bring the federal resources to bear on the spread in order to anything we can do to deal with testing, deal with case management, to deal with coordination, and all the federal resources will provide to the states as we're trying to deal with the outbreaks and where they're larger, where they're impacting greater areas such as like Washington State, et cetera, not nearly as much as in West Virginia. In the U.S., mass gatherings of more than 10 people are highly discouraged to limit the spread. Most schools are closed. None of this may be any news to you, but the point is, we've only seen just in the last 7 weeks how much these cases have increased. So now we're going to give you move into some resources. Okay. The other thing is I wanted to bring to your attention about PPE, personal protection equipment, masks, gloves, gowns. Fiction is that everyone needs an N95 respiration mask to reduce the spread of the virus. That's not the case. Healthcare workers need them for sure. There's CDC recommendations about personal protection equipment. We put the hot link there. It includes masks, gloves, eye protection, possibly gowns. But the tip is that if you're even a healthcare worker, you have to actually fit test all your personnel to ensure that you have maximum protection. So oftentimes if you have facial hair, you can't use them. You're gonna have to shave your facial hair in order to fit your face. And what that fit testing is, there's different sizes. You can't just go grab any old mask. Small, medium, large, you have to do a process to fit test to make sure all your personnel are protected. The other thing is surgical masks should be worn by ill patients to reduce the spread, but not everyone, as this photo here on the bottom left here, putting the water bottles over themselves and all the plastic, and I don't necessarily think that really helped. Also, too, oftentimes with masks, if you don't actually, they have to be pinched to your nose. They actually, they have to be discarded after a number of hours, and so you have to have there's a process to it. It's not like I have one mask and I'm going to use that for the next year. There needs to be a process. So if you don't have a policy for this around personal protection equipment, we'd be happy to point you to some resources. Okay, I'm going to now give this over to Karen Garrison, our Director of Aging Services, and she's going to share with you the impacts related to compromised health systems and seniors.
Good morning, everyone, or good afternoon from wherever you're calling in today. This is my name is Karen Garrison. I'm the Director of Aging Services, and so my focus is really around discussing the impacts of seniors and people compromised who have systems that are having difficulties. And this population actually is hit even harder with the COVID-19 spread. The World Health Organization says that elderly with underlying illnesses are most at risk for COVID-19. And also, we want to identify anyone with compromised immune systems. So that could actually be a child going through cancer treatment, or an adult, or even a young person. So we want to make sure that we identify those people so that we can make sure that we take extra steps to make sure that they are healthy and that they have any service needs that are met. The number of infections, severe illness, and death is among people with is much higher among people who are chronic smokers, which makes sense because so many of the symptoms have a respiratory basis, and so if you're a chronic smoker, you are already your lungs are already in a compromised situation. Individuals who are 60 to 80 with chronic illnesses, again, heart disease, chronic respiratory disease, COPD, CHF, and anyone going through any immunosuppressant therapy are especially at risk. And lastly, to reduce the rate of transmission, many parts of California and other states are restricting family members at skilled nursing and assisted living facilities. And this is so that the spread does not come into their facilities, and also so the spread does not leave. Okay, we're going to go on to the next slide. We're going to go on to the next slide, which actually talks about, again, reinforces the fact that older people, especially those 80-year-olds, are actually getting COVID-19 at much higher rates. This data is actually from China, from Hubei, China, which is the epicenter of the virus, and you can see that it again disproportionately affects people from 60 to 80 plus. So especially those olds, those 80 to 90-year-olds are at definitely higher risk. I suspect that some of these, I do suspect that some of these younger age groups are a little more immune compromised and have pre-existing conditions. And so this just kind of gives you the graphic of, okay, it's much larger skewed to that older population. And so really, as we go into mitigation strategies, we really want to make sure that we're protecting that age group. In this world of, there are the nuclear families, but there are a lot of extended families that live together with multiple generations. And so it's really important that we think about and ensure the safety of this older population by making sure that older individuals are not the ones that are doing childcare with the younger children who are school-based, things like that. So there are a lot of strategies that you can bring to bear to decrease transmission. Let's go on. And I think really so much, one thing that's really important is that preparedness always has to start on the individual level and on the family level. And so because we already know that we've identified that older adults, disabled adults, and really anybody with those underlying health conditions are more at risk, we want to make sure that we start that preparedness, those preparedness activities at home. So we're going to start by stocking up on fresh and stable, shelf-stable food, water, medications, and personal hygiene supplies. What I mean by that personal hygiene supplies is if a person has incontinence, making sure that there's enough personal hygiene pads and, Depends and things like that. Those are the things that actually make people feel much safer at home because they have what they need to be at home for extended periods of time. In the Bay Area of California, we've just had a mandatory shelter-in-place orders, so people are going to be staying in for extended periods of time. Most of the schools in California have actually shut down, and so people are at home, and so we want to make sure that they're ready. Also, for those older adults, making sure that you're connecting directly with your pharmacist to ensure that your supply of medications are ongoing, that you, if you're low on something, that you want to make sure that you're checking in with those pharmacists to make sure that you can get that. Maybe you have a specialized order that needs to be special ordered. We want to make sure that you're always going to have the medications available that you need. Also, social distancing, keeping 6 feet away between yourself and others. That's very important. And so making sure that you've got a cocoon of space around you when you're actually out and about. And this shelter-in-place orders do not mean that you have to stay in your house all the time, but it's really about making sure that you're when you are out, you're managing your social distancing. You're actually going out for essential things like food and medications. And you're also avoiding things like public transit, cruise travel, and non-essential air travel. So if you don't have to take a trip, please don't. There's been a lot of news around cruises and people being quarantined. So I think now is the time to stay closer to home. And in the Bay Area, public transit is very big. If you don't need to go somewhere, again, forego that trip. Stay at home as much as possible to further reduce your risk of being exposed. And lastly, as older adults, making sure that you're linking with family and friends to ask for help when you need it. If you need a ride rather than getting on a bus, it's always better. If you need grocery shopping done, can you do that online? Can you do that? Can you have a neighbor shop for you or other errands, picking up your medications or your personal supplies? These are all mitigation strategies that actually help on a preparedness level for individuals and families. And I think it makes it easier when you have these guidelines to help you stay safe. We're going to go to the last slide, which is coming up. There you go. There you go. So we are all part of communities, and we have community providers. So those providers could be a skilled nursing facility that serves older adults primarily. But we also have community centers, senior centers, case management programs. These are all essential services, but some of them are more communal based, meaning some of them are community centers where you come in for a congregate meal and social activities. Those kinds of programs are probably going to be closed in your community, but they also serve as hubs for services. So let's not forget about that. We'll talk about that in just a minute. Continue to use universal precautions such as frequent hand washing and social distancing. When you're working with your clients who actually still need services, as a providers, you are still providing those essential services. So if it's home care or it's case management services, making sure that you're continuing to connect with those clients because they actually have service needs now that they're even more isolated. And so we want to identify the homebound clients who have additional service needs during this time of isolation. They might need additional food. They might need additional medication. They might need additional personal hygiene supplies. Strategize with your care team how to bring both medical and non-medical services to your clients. You are often the lifeline for those homebound seniors. And again, those homebound seniors are really the most at risk for getting COVID-19. So we want to make sure that that there is still that level of service, but it has to be done in a different way. Also, you want to create community-based mitigation strategies to get food to homebound clients, such as home-delivered meals and groceries, and pickup services at senior centers. Many of your local senior centers are acting as service hubs for food and vital services. Also, use the phone as a lifeline for homebound clients to maintain contact, identify emerging service needs, and to decrease social isolation. As a big secondary consequence, right now it's not as big of an issue, but in a few weeks when people have been isolated for weeks and weeks and weeks at a time, that is where social isolation really kicks in. So that's another whole webinar right there. But anyway, implement active screening of clients for fever and respiratory symptoms, especially home care workers who are going into people's homes because they need to make sure that they're providing those personal care services. Make sure that you're creating some kind of screening for those clients so that you are understanding who needs what. And if somebody is infected or has issues, then you actually have the heads up on that. And lastly, provide staff, participating providers, and volunteers training on all the aspects of COVID-19. It's very important to keep training, and even despite the fact we're in a place where everyone is really busy with figuring out how to provide services, training is an essential part of that. Okay, we're going to move right on to Lori, who is, there she is. Thank you so much.
Thank you, Karen. Appreciate it. So
You're
Lori,
welcome.
Thanks, Karen and Nora. Hi, everyone. This is Lori. So now that we have a pretty good view of what COVID-19 is, I'm sure most of you have been hearing it, all the time. I'm gonna kind of calm the nervous system, and we are bombarded with stimuli all the time and information in our everyday lives, and especially now all of the news, all of the newspapers, all of the media is kind of overrun by COVID. And so even though we might not necessarily feel the impacts directly, it is overstimulating for our entire nervous system. And we feel it either in the moment or it can impact us later on. So I'm going to walk you through some things that might help curb like any of the stress or anxiety that you might be feeling. So to begin with, we as human beings operate best when we know what to expect and when we educate and prepare ourselves. And so we might not realize that when we are seeing all the stimuli, when we hear about masks, when we like know that there's a shortage of supplies everywhere, it will impact our entire being, not just our thoughts, not just our mind, but our whole being. So emotionally, we may feel shocked that this is happening. We may feel anger at various different entities. We may be more irritable. We might feel helpless, helpless to help our neighbor or our families or even globally. And we might feel like out of control and that we don't really know what the next steps are. It also will impact our cognition. There's a lot of research that shows that stress and anxiety does impact how our thought patterns, and it changes how our brain functions in a way. It can impact our concentration, our memory. It will increase our worry, and at times we might have intrusive thoughts. It also will impact us physically. As we know, when we lead our everyday normal stressful lives, we might feel fatigued and it might impact our sleep. And so this is kind of all of that magnified. We might feel, by hyperarousal, I mean, we might be like on edge. We might feel a little bit, we might have like somatic complaints. So our bodies might hurt more. We might have headaches. We might have some more physical symptoms that have nothing to do with COVID, but just somatic, like our stress impacts how our body feels. Also, behaviorally, we might have more anger outbursts. We might feel, even though we're isolated and it's really hard, we might want to socially withdraw more. We might feel depressed. We might have more interpersonal relationship difficulties. All of these areas, I also want to emphasize, look differently for different ages. And so for those of you that are also parents on the line, you might see a lot of these impacts manifesting differently in your kids or in your friends or in your like parents. And so it's different ages have different manifestations of all this, even like a 5-year-old versus a 12-year-old. So it's really important, especially as we're isolated, to keep in touch with people and help each other. So if we can't identify in ourselves when we want to reach out for help or reach out to our neighbor, we can keep an eye on our friends and family. And so if we're seeing or experiencing increased substance use, I know for me and my friends, everyone is talking about, oh, let's like stocking up on wine and alcohol. And I'm pretty clear on how to like minimize that, and that we want to really be careful about letting that get out of control. We want to look for depressive symptoms, especially if people are already prone to that. We want to look at changes in eating habits and behavior changes, as I said. And I mentioned unhealthy anger here because I think as a society, we tend to say that anger is not okay, but it is. It's okay to feel anger. It's how we express that anger. And so when we're expressing it in a dangerous or unhealthy way, that might be a time that we need to reach out to others or look for support. If someone has already experienced a traumatic event and or other disaster and emergency events, often that is like a collective experience in our bodies. We call that compounded trauma. So we want to be aware of how that's impacting us now. We want to look at complicated grief. Again, when we have multiple losses or multiple experiences of grief, it can also look different. And then again, interpersonal violence. Often in most disasters and events, we see an increase in family abuse, relationship abuse, so forth. So when we go on to the next slide, we'll look at the time frame, the timeline. This is what kind of this in the disaster world, this is a pretty common graph of what the timeline of disaster behavioral health might look like. So what are the emotional impacts? Of course, it will depend on what the contributing factors are. So moving my left to right, some of the possible contributing factors might be some of the things I just mentioned, and also the uncertainty. Like today, when we're looking at COVID, we're getting different pieces of news throughout the day. Maybe we're hearing different statistics of impact, different statistics of availability of resources or deaths. And so that can be really hard when we don't really know what's contributing factor. We also might have, again, multiple different experiences within your family, within your community. So when we look at the timeline itself, we've all experienced like what a warning, we look at the warning phase, and that's like, if let's use a different example. So in hurricanes, we have the ability to see through our weathermen and women what that hurricane system pattern is looking like. So we can prepare for that. Some events we can't prepare for. So when we can prepare, where the outcome is a little bit better. So we have the threat. I'm just going to keep moving along. So we have this threat, which is kind of where we are right now. We're in the impact, rescue, response phase. We're all taking inventory. That's changing every day. We're taking inventory of our materials that we can use to protect ourselves, of our food, of our pharmaceutical needs, of our family and friends, of our family and friends' well-being, of our staff well-being, of our organization well-being. We're kind of collecting all of this information and doing our best to prepare. So as we move up the line, some people, we go into this heroic phase where we want to help. And, we're seeing that now, where a lot of people are reaching out and volunteering and looking to food banks, especially with all of the schools closed. I know here in Seattle, we have different areas where they're doing feeding sites for students who rely on school lunches and school breakfast. So we're kind of in that phase right now, which what we're going to see is prolonged over time. As Nora was saying before, we don't know, this can last for up to a year to longer. We're in a honeymoon phase where people are really working together, and you see people within your smaller, your immediate and larger community kind of reaching out and helping each other. At some point, and again, this is all very estimated in general, at some point, people will start to feel the real impacts and the anxiety and the length of being isolated, and depending on where you live, how long that might last. We see it in Italy and all around the world, it's taking its toll in different ways and in different time frames. So as we continue down that timeline, that will manifest in different ways. And it's important to remember that we need to keep coming together as a community and taking care of ourselves and preparing for yourself and your business and your family as much as possible. As we move through the phases, we as a community, as a society, we end up working through our grief. So that's kind of coming to terms of where things are. So kind of following if you can remember the slide before in the pandemic, this is at the other end. So looking at slide, I think it was the phase 5 or 6, we end up helping, we can kind of take stock at what those impacts are, and that this is a reality, and how has it hit us economically, and how has it hit us in our health and in our immediate communities. And then we come to this last phase where we can really assess and build this like new normal. And so the reason why we use the term new normal is because I think we think people have this expectation that things will return to exactly how they are, but it's really a new normal, and it's something that you are developing, and it will normalize, and we will absolutely function normally again, and we will all be able to travel again, but things might look slightly different. And so coming to terms and accepting like that it changes, everything changes, helps in our long-term ability to handle that stress. So as we move on to the next slide, we can see how all of this translates. So first looking at how you can help take care of your organization or your business. So if you are a leader of your business, it's important that you are able to lead and not try to do everything. So having someone who's like a dedicated liaison or a dedicated coordinator to talk to your staff, to put messages out, for you to kind of act as a go-between is really important, so you can still lead and keep your business and organization running. Having a clear communication structure is really important. It helps to have those messages be really clear and not get muddled. And it's also really important to have those communication structures have as little like stress-induced language or images as possible. We also want to squash rumors. So as a leader, of course, we're all seeing media. People are seeing different things. There's a lot of like information out there that is not true. And so you want to be able to help identify that and squash the rumors and misinformation. You also, as leaders of your organization, you want to help to organize structure and routines for your staff. So whether that's having online video conferences or keeping schedules, research shows that having routines and structures in stressful events and disasters and public health emergencies really helps people. It helps our mental well-being. It helps people feel engaged and empowered, and like they're not as impacted. We want to also promote healthy activities and supports, and so we, encouraging people to still go outside for walks, as Karen mentioned, even though some areas are more isolated or in self quarantine. Most people, the majority of us, if we're not directly impacted, can still go out for walks. And that is really important, going out for walks, going out, using your healthcare online systems. A lot of people are putting out like physical education. Help your staff volunteer, and also prepare and support for plans post-event. I like to call it physical distancing versus social distancing, just because even though we're social distancing, we can still use our internet and our phones to keep in contact with each other. So when we look at, that's for like your business, keeping your business running. When we look at the next slide, it's also really important to take care of yourself. So again, practicing physical distancing, not necessarily complete social distancing. The power of the collective is really important. Again, having realistic expectations and acceptance that sometimes we just don't know, especially in this situation, is really helpful. So we're not disappointed and we're not kind of overcome by what's to come. Educating ourselves, preparing for things helps to minimize stress. Again, connecting and communicating, have virtual get-togethers. I know my friends and I were starting to plan video tea dates and things just to keep contact. Use your spiritual and faith-based support, even if churches or synagogues or whatever your resource is. A lot of institutions are providing online services and online support. Again, keep your routines, volunteer. And again, we always talk about we don't have time to practice self-care routines. This is a great time to do it, even if it's 5 minutes a day, even if it's a few minutes at a time. Figure out what's going to work best for you and monitor your thoughts, practice breathing, and keep those daily reminders for ourselves. And be gentle. Be gentle on yourself, on others, and don't forget to keep a sense of humor and be creative throughout all of this. And then we'll pass it on to look at other strategies. Thank you.
Thank you so much, Lori. You gave us a good lesson. You know, I learn always in working with you. So I'm going to talk a little bit about business continuity planning for your healthcare organization. Some of these things I just want to reiterate, obviously around the whole piece of infectious control procedures. I also want to reiterate what Lori said about activating an incident command system to manage the incident. Again, this is a marathon, not a sprint. This is not something that's going to happen and be resolved like within a week or two. It's just going to be a long process. And in most response events, for whether it's a hurricane, et cetera, your response process is only a few weeks and then you go into recovery phase. We're going to be in the response process for actually probably, like I said, up to a year. The other thing that's important is to coordinate your medical care with your local public health agency, hospital, healthcare coalition, because you have to coordinate that medical surge capacity. And this is the time to kick in those mutual aid agreements you may have. And if you don't have them, now is the time to get them and have that conversation. Obviously, the adherence to standard contact and airborne precautions, including the use of eye protection, hand hygiene. We talked about all of this. Allow non-patient staffing, people that are not patient non-patient facing staff to work from home, and train your staff on what your infectious control procedures are. They may change over time because of the disaster, because of COVID-19, as we learn more about the transmission pathways. Other things I want to talk about, we have a lot of folks that are they're from schools, which is great. This is should not be as a shocker, but explore the online learning options for your students, your staff coordinating, and also your parent communication. I want to underline very much what Lori said, is that clear communication is really important. You know, we just heard in California, you know, schools probably won't come back until the fall. Basically, that's a lot of information to absorb. So that parent communication is important. Develop an incident management system team to coordinate. It's not just you. You know, use those communication channels you may already have, or think of new ones to communicate what's going on, open and closing. Also monitor. I want to underscore too what Lori said about the monitoring, and also Karen too, monitoring the mental health of staff, students, patients, parents, et cetera, as the event goes on. Let's see. Next slide. Okay. Now I want to talk a little bit about the business owners that are joining us today. Again, this is not that different. Identify who's in charge, what decisions you have to make, how to stay afloat. This is time for you to figure out contingencies. And if you don't have these contingencies, now it's time to have those conversations with your staff. Again, communications channels about business openings, closings, client, patients, or whoever you serve. Develop a work from home policy. If you don't have one, We can have one we can share with you, but the work from home policies are really helpful. And that doesn't work for everyone. Like if you're a healthcare provider, you can't really work from home if you're providing patient care, or if you're whatever type of business you may have. But developing those work from home policies, cancel those in-person meetings, and we may not be under these orders, the shelter-in-place orders forever, but cancel in-person meetings if possible, keep ill staff at home, have those procedures. Also, too, plan for alternate staffing patterns. Like if your business is used to running, you have 100 employees, you cannot guarantee those 100 employees are going to show up to work. They themselves might be ill. They might have a family member that's ill. Their schools are their kids' schools are closed, and it's what are they going to do with those kids? So figure out alternate staffing patterns now. How you can provide and stay in business and still serve your clients, customers, etc. Also find alternate suppliers for raw materials if you're a manufacturer, if you have goods and services you're used to counting on. Look for alternate suppliers now. Supply chains are going to break. They're already breaking. And if there's something that's crucial to your business, in order to stay in business, identify more than one provider so you're not really counting on just that one supplier or vendor. Determine what your alternate business process is for your essential business functions. That's a process we call business impact analysis. You want to do that now. Who does that? What are my dependencies? People, process, technology, supply chain. For each of those business functions, what are the things that would impact my business? So figuring that out and develop a business continuity plan. Find an alternate IT access. We all think that Comcast and AT&T and they'll be here forever, but we just don't know as time goes on. I mean, we're happy to be lucky in most disasters. Whether it's a hurricane, you usually have power goes out and there's no internet, and those things are always difficult. But we again don't know as this continues how what may happen on IT is that everyone works from home, and you might have to increase your Wi-Fi or get a Wi-Fi or something for people, because more people are going to be working from home. You might be able to stress the system and really slow the download speed, etc. Obtain a business line of credit now. Do not wait until things are in dire straits and you have to close for the next 3 months, and that must be really difficult. Most people, we're a small business as well, and we having 3 months or 6 months of operating revenue in our bank account, that doesn't always happen. So don't wait till things get dire to obtain a business line of credit. You have a business plan. If you do, it's time to update, review it, and now's the time to do that. So we've got a few minutes yet. We want to share. We want to see what questions you may have. No questions? Oh. See what questions you may have.
Go ahead and type them in.
Yeah.
We will answer them.
We'll do our best. Okay. All right. Well, we want to just also share with you. We want to learn what your issues are, what you might be dealing with, etc. So, if you don't think of something today, again, you're all in. Many of you are. We have a couple questions that came in.
Lots of recent posts about ibuprofen being contradicted if it's for COVID-19. What's the truth? Can't find it on the World Health Organization or CDC sites. I saw that post on actually Facebook this morning, that there was a research going around saying that it exacerbates the symptoms of the virus.
That is not really sure what the situation is with that. I would think if World Health Organization and CDC are your best, and also check with your local providers. The other thing I would recommend, check with your doctor, check with your health system, and see what they recommend. Yeah, but Facebook post, and also that's a good point about communication. You might be seeing some things about that, and it's hard to sometimes. It's hard to see, a lot of information's going through. So I would check with your provider.
Joe says, I'm having a hard time revising and coming up with flexible personal policies and how to keep paying hourly workers while limiting services. Do you have any resources for what guidelines to follow?
That's a kind of more specific question. I would say it as best you can as your resources allow you to do what you can to, like, if you can limit services, and do the best you can. Again, that line of credit that we recommend is a best way to go because it'll help you figure out what that process may be. And again, there might be more stimulus packages that are coming through from the federal government. We hope that that'll help us as well. But again, do the best you can with the information you have at the time. Make a decision. And again, based on the OODA loop, you may have to make another decision down the road. That might be a tough decision.
Jumping back to the ibuprofen, we were just sent a link by Lori, and we can include this link in our follow-up email. It just gives a little bit of information about the research, and you guys can go ahead and read that for yourself. We do have another question. What are your thoughts on next year? Virus shift or jump thoughts?
I think in looking at the trajectory and seeing my concern about the virus is that it's going to get worse before it gets better. And so we're doing extreme social distancing, as I said, both Karen and Lori also underscored, is that it's going to get really old really quick. And as time goes on, people are going to want to go back to their daily lives, and that's when it's going to spike again. So we want to just, again, this is wartime. Think about it, this is war, right? The war, and obviously the entire world at war against the coronavirus. And so in wartime, these are extraordinary measures we have to take. It's a bummer, we understand, but you got to do the best you can. But yeah, I do think that it's going to get way worse before it gets better.
We have a specific one for healthcare. This is from Brittany. For outpatient surgery centers, if we don't have N95 masks right now, can staff surgical masks still be okay? We are doing pre-screening of patients in PPE, but staff is worried about possible asymptomatic patients.
Yeah, that's the other thing about, that's a really good question. So as outpatient surgery centers, for the most part, you aren't going to have someone come into your center if you've already screened them to make sure if they're sick, that obviously they're not coming to you and you're not going to let them in the building, which is smart for reducing the transmission. Again, we still don't know the full transmission pathway. We still don't know how, if someone is asymptomatic and they're actually able to spread the disease. That's part of the part that we don't know. So the questions that we're answering right now, we might have more information as time goes on, but unfortunately, what we recommend, I think surgical masks definitely can help. You are also wearing gloves as well and potentially gowns. Again, we don't know the full transmission pathway.
I have a question from Jack. He wants to know your thoughts on a second wave coming next year after we have dealt with this version of the virus.
Yeah, I think that we're going to see definitely another wave. Hopefully it's not nearly as deadly. Hopefully we have more information. So we have a better way to, things that we'll need to avoid, whether we have to do another round of whether they have to do another round of social distancing. Yeah, I think that is another way, but it may not be nearly as deadly if we're able to take the lessons learned from this experience as time goes on and apply it to the future of it.
Okay. So thank you for your questions, guys.
Yeah, definitely. If you have further questions, you can always want to share with you our contact information. We're also developing a pandemic planning guide. Many of you have said, how do I get all this stuff done? It's obviously it's based on the WHO pandemic phases. It's a guide to develop both a response and recovery plan and business continuity planning, kind of building on one of the slides that we talked about. Also will include a 30-minute consultation to learn more about your pandemic process and any kind of 30-minute conversation about how we can guide you through this process. Okay. And then this is just a little bit about us. We've been in business since 2009. We were named a Women-Owned Business of the Year in 2018 by the Sacramento SBA. We work with clients all over the country. We vast majority of what we do is we do remote. So we can do all of this remote. We obviously use GoToMeeting, GoToWebinar, extensively phone calls, email, Slack, whatever is necessary. But our goal is to support you. So whether it's pandemic response that we're facing with, or just emergency operations planning overall, drills and exercises, we can do a vast majority of that remote as well. You know, compliance audits, improvement planning, we can do that. So if you need our help, let us know. And then if you want to know how it's to help, you can book a call from this hot link, and we're going to put that information out with a follow-up email. You actually have our webinars. We do at least one webinar a month. And so you can always go there to our site and find out the webinars. We're repeating this webinar, so if you think this was helpful, you want to share it with your colleagues, we're going to do it next Wednesday as well. Join our monthly newsletter. If you need a speaker or a trainer, at this point, we're going to say remotely, we're here to do that. If you have an upcoming webinar, or if you want to, if you're a part of an organization, you want us to share, we'd be happy to do that. We do that all the time. And this is our contact information. So thank you very much, Karen and Lori, for sharing with us your really vital information. Hopefully, we're here to help. Anything we can do to support you, please let us know. Reach out. You've got all that Twitter or Facebook, Instagram, etc. Tweet with us, you know, post stuff on our LinkedIn, our company page. But so glad that we're here to offer this information to you. Please let us know in the future how we can help.